Hi there, this is Ken Heron and I'm talking to you again from my back porch. Today let's talk just a little bit about the healthcare industry. Healthcare is a business. It's a part of the private enterprise system. It needs competition. It needs all the things that other businesses need. They need to keep their costs down below whatever their income is, and the difference between the cost and the income is the profit. It needs government regulation. The government needs to regulate it in order to keep it consistent from one place to another and from one business to another. But it does not need government control. It doesn't need government ownership. It doesn't need the government to be the insurance company. When I was young, you went to the doctor's office if you were sick, or you sent somebody and the doctor came to the house. You settled with the doctor, paid him at the time, or bartered with him at the time, and the doctor could charge whatever he wanted to. I mean, if you were very, very wealthy, he might charge a higher price than he would to somebody that was poor. He might also do some of his medical treatment for free. In about 1948, I think it was, somewhere along there, the government decreed that every company that had over 25 employees or 25 and over should provide health insurance to all its employees. Now, most of the time they provided it for the employee and allowed the employee to buy the insurance for the family, and it was reasonable. When it started out, the prices were reasonable at the hospitals, the doctors, and at the drugstores, and the premiums would be divided among all the people. Everybody paid the same amount per person, essentially, and it was not high. And as more and more people were insured, the insurance companies were trying to charge perhaps 10% more than they were having to pay out, so that they would have a 10% profit to pay for their employees and their stockholders. But it didn't keep on working that way. They discovered probably somewhere, if you get 1 million people that you're insuring, $1 a month is not very much to the employee or to the person you're insuring. If you have 1 million people, that's $12 million a year. And if you're trying to make 10%, that's $1.2 million profit. So the insurance companies realized that the higher the bill was, the more money they could make. So they didn't object to the increasing of cost by the hospitals. And that's how the cost began to go up, up, up. There was no stopping it. And as much as they could get for the premiums, the insurance companies took that money. It was the beginning of the spiraling healthcare cost. And if you think it's not good for everybody, the hospitals are all building new buildings, building new wings, buying new equipment, and the doctors are doing quite well. So we'll talk some more about the healthcare in another session on these videos. But I just wanted to tell you, God bless you, and God bless the United States of America. Let's solve some of these problems and get them behind us.